So these COVID-19 vaccine pamphlets have been popping up everywhere around the state. So I decided to read this two-page pamphlet and tell you about the COVID-19 vaccine fiction from fact. So let's jump right into what states are passing around. Myth: the COVID-19 vaccine causes fertility issues in women. Truth: there is no scientific evidence that the COVID-19 vaccine negatively impacts a woman's fertility. Falsehoods about the vaccine and fertility have gained traction online recently and have been perpetuated by doctors known for their anti-vaccine views. Contracting COVID-19, however, can cause serious complications for those who are already pregnant, including blood clots, hypertension, miscarriage, and postpartum hemorrhage. Myth: the COVID-19 vaccine was rushed onto the market. It can't possibly be safe and effective. Truth: studies have shown that both the moderna and pfizer vaccine are around 95% effective at preventing an infection when a person is exposed to the COVID-19 virus. Furthermore, should a vaccinated individual contract the virus, their risk of severe illness, hospitalization, and death is greatly decreased. In a clinical trial conducted by Pfizer and BioNTech involving over 43,000 participants, only 8 were found to have contracted the virus after receiving their full dose. No serious side effects from the vaccine were ever reported. To date, roughly 146 million people in the United States have been fully vaccinated, and the official website for the Centers of Disease Control and Prevention states that serious safety problems are rare. Myth: the COVID-19 vaccine contains harmful ingredients like a microchip or mercury and could even alter my DNA. Truth: the most common COVID-19 vaccines, such as Pfizer and Moderna, are mRNA vaccines. mRNA vaccines contain the mRNA molecule along with the fats, salts, and sugars to help keep the vaccine stable during transport and storage, as well as protect the mRNA so it can do its job. Once the vaccine enters your body, your cells begin making a piece of spike protein that mimics the coronavirus. Your immune system then gets to work fighting off the virus, creating antibodies that are primed and ready to attack the COVID-19 should you be exposed to it in the future. Now I'm going to reread this. Once the vaccine enters your body, your cells begin making a piece of spike of protein that mimics the coronavirus. Your immune system then gets to work fighting off the virus to create antibodies that are primed and ready to attack the COVID-19 should you be exposed to it in the future. That's something powerful right there. So just like we thought about flu vaccines and how, it gives you the flu so you could fight it off in the future. This is exactly what you were thinking. This is written in the pamphlet that's been given out. But let me continue. We're still in the truth part of it. The COVID-19 vaccine does not contain live COVID-19 virus, microchips, mercury, or any substance that can alter your DNA. The mRNA contained in the vaccine does not alter your cells, and your system disregards the mRNA shortly after the protein produced process is finished. Microchips could not feasibly fit through the slim needle used to draw up and inject the vaccine, nor would they be able to transmit such information once inside the muscle. Technology as complex and advanced as an impenetrable microchip that could function inside your body simply does not exist and therefore would not be present in the vaccine. Myth. I don't trust the government, so I don't trust the vaccine they're pushing. The truth. The unfortunate reality is that the COVID-19 pandemic has been publicized over time and politicized over time, turning what should be urgent public health matters into a shouting match, putting political parties against one another. It's important to remember that while getting a vaccine is a personal choice, one that should be carefully considered and thoroughly researched, the benefits of receiving it extends far beyond the individual. By protecting yourself from the COVID-19, you are protecting others. All COVID-19 vaccines being administered in the United States went through rigorous development, testing, and evaluation processes and have been found to be safe and effective. Cooperation with scientists, physicians, and biochemists, public health officials, and others from around the world helping us bring the vaccine we have today, meaning no one entity, government or not, is responsible for the COVID-19 vaccines you see on the market. So that means everybody had their hand in the cookie jar. And if you want more information or where you could find the digital copy of this brochure that I'm reading, you could find the site at waynecounty.com/COVID-19. And that is what I'm reading on the back of this pamphlet. So tell me your thoughts on COVID-19 and the vaccinations and what you thought about this pamphlet that's being handed out that's giving you truths and myths about the COVID-19 vaccine. I learned a couple things while reading this to you. I wasn't familiar with the mRNAs, and I'm going to look that in more. Look that up a little bit more. So if you're familiar with it, go ahead and drop below and tell me a little bit more about it. Thanks for watching, listening, like, comment, share, subscribe. Thank you.